I was in Cuba in March, and they had started in March using cloth masks, mid-March. It's taken us more than 6 weeks into the epidemic. It's only today that we announced that a cloth mask is compulsory in public. If we had done that long time ago, when we started the lockdown, so that when you sit in a taxi, you have a cloth mask, you don't sit 7 of you incubating each other in a small environment that you sit in 30 minutes to drive from Soweto to town. You're incubating. So it's those things. So it's an outlook thing. It's not about the fact that our system is poor. It's about our emphasis. Our emphasis is on get sick, we will fix you. Our emphasis is on curative medicine. In Cuba, they have that.
Yeah.
But they are not waiting for people to be sick. They are equally funding promotion of health and prevention of disease. And they are making it their doctor's job, and they are paying their doctor not only to cure people, but also to promote health and to prevent disease.
Is the challenge, though, in South Africa not one of resources? I think the knowledge is there, but perhaps we just don't have the money and the resources to build as many hospitals as we would like and have as many doctors in the hospitals and nurses as we can afford.
But that's precisely the problem, Peter. We're looking at it from a hospice-centric basis. Invest in the health of the people. If we want a healthy community and health care that is affordable, we should be putting a greater emphasis on access to water, on food security, on education of the population. People don't understand that if you keep your people not having access to clean water, no proper sanitation, no proper education, they become a breeding ground for health problems. And you are waiting to try and fix them in the hospital. We are doing bottom of the cliff medicine, not top of the cliff medicine. And by that I mean, Peter, we're waiting for people to fall off the cliff and have a good ambulance service and casualty and ICUs for them when they've got broken limbs.
All right.
Instead of going to the top of the cliff and preventing them from coming down the cliff.
All right, so
and having a small system at the bottom to deal with those so that the burden, the need for hospitalization, the need for being hospice-centric becomes much less because we are in our communities.
All right, so a fundamental shift in thinking about how we do medicine in the country. Perhaps finally, if you could just give us your outlook, your thoughts about how we've fought COVID-19 so far and any concerns that you have as we ease down to level 4 on Friday?
I think the response from the president and the state has been tremendous. And we've been able to flatten the curve. I think the key problem that I have is our societal attitude, our unlawfulness. If you look at Switzerland, when they say cloth mask and they say social distancing, they don't have to lock people down for them to do that. So my concern is our unlawfulness. Because as we get into level 4, all the restrictions of level 5, we bring into level 4. The only thing that changes is that certain categories of workers and industry are opened up. But we still need to stay home. That needs to stay home. I am heartened by the fact that cloth masks are now compulsory because people need to understand this. The way we deal with COVID is not defeated in the ICU. COVID is defeated in the village. COVID is defeated by hygiene, cleaning of hands, water and soap. COVID is defeated by covering your mouth and nose. COVID is defeated by physical distancing. It's defeated by the cough etiquette. It's simple things that our grandmothers used to tell us. You know, when people used to say, I have a cold, don't come near me. Grandma used to say, you've just come from outside, wash your hands. You've just been to the toilet, wash your hands. You are coughing, cover your mouth. That's how you defeat COVID. Those things are largely free of charge or very cheap.
All right.
So we should understand as society that defeating COVID is not in how many ventilators we have. It's in what we do in society. Cover your mouth and nose. Wash those hands. Physically distance. Cough etiquette. Then we could get back to normal soon. Be compliant. Don't wait for the cops and the defense force to be the ones that force us to comply.
All right. And then perhaps finally, I mean, there's quite a lot of debate in terms of restrictions surrounding alcohol and tobacco. As a medical practitioner, what's your take during a COVID pandemic? What should we be doing with alcohol and tobacco? Restricting their use or saying let people enjoy the fruits, the fruits of their labor?
I think alcohol has a huge cost on healthcare. Our casualties are full of alcohol-related patients. The issue of domestic violence, just assault in our alcohol places, traffic incidents, the carnage that you have in relation to alcohol and the heavy impact that it has, heavy burden that it brings on health systems, it's obvious to all. So we can see the relief that the casualties are much lighter now. So the impact of alcohol on the health system and society is profound. When we come to tobacco, we know that tobacco causes preventable illness on the individual. So tobacco impacts the individual. Now, on the tobacco side, what we must remember is that a smoker is a person. So even though we may talk about the issues of health in relation to COVID, no evidence has been laid about the negative impact on tobacco in COVID. We know historically that combustible cigarettes are the biggest cause of preventable death. But any connection to COVID is not based on evidence.
Okay.
It's based on conjecture and our moral positions, and we should not transpose moral positions in this regard. And I was quite intrigued by the fact that there was a relaxation intended for level 4, but based on uproar from society, it's reversed. And my concern is about consistency in decision making. If you compare with the death penalty, we've never took it out to populism and what people say. We took a practical decision when we say life is sacred. Now, but on this issue, whatever decision informed them, I'm just concerned about them being swayed by 2,000 people.
All right, that was Dr. Kgosi Letlape.